Hello and welcome. And today I'm very pleased to present my presenting, or am I saying hello to Dr. Catherine O'Leary. Hello.
Hello, you can present me if you like. Nice to
We're,
be here.
we're going to talk today. This is I'm going to do my usual hold up and it never goes into focus. Coping with psoriasis. Now, I have psoriasis myself, albeit I'm very lucky and don't have it very badly. So for me, this was very interesting to read your book, Catherine, and it was a real insight on things that I thought I have recognised in myself and with others, because we have a big community of people that have psoriasis, but it's not things that we would necessarily underline, if you know what I mean, or think further about it. And your book, I just felt was, gosh, yes, that answered a lot of questions that I didn't really know
Right.
I had.
Right, thank you. That's good, really good to hear, because I think a lot of the times we don't examine ourselves, do we? We don't think about our belief systems and the way we react and the way we cope with situations. We just are, aren't we? And I think because I'm a psychologist who has psoriasis, perhaps I've put myself under the microscope a little bit more, and then I recognize when I'm doing certain things or responding in a certain way that fit with like the psychological theories that I've learned and that I support other people in using.
Mm. And I think what was so what I liked about your book, along with all the others coping with, is that it's a professional person talking about something that they from their own experience, and it does make a difference with that
Mhm.
lived experience,
Yeah,
I believe.
completely, because y- I'm not saying that people who work I work with people with cystic fibrosis and I don't have cystic fibrosis. And that doesn't mean that I can't work with them and use my psychological skills to work with them. But I do think there is a difference when you talk to someone who has the same condition, because they just get it on a completely different level, don't they? They've walked in your shoes and they understand you and understand, like you, I expect when you were reading the book, there were things that were very familiar and you just thought, oh gosh, yes, I can totally empathize with that. So I think this series is unique in that it is clinical psychologists with a condition or facing a challenge, and their own sort of unique perspective as someone in that situation and as a psychologist.
Mm. And I know we've picked out various things to kind of go through, which I felt really stood out and was things that we mentioned earlier to highlight for you to go, for one to go back. And I think particularly with psoriasis, because it isn't just a skin condition. It is something that does, depending on the severity, actually along with eczema and acne as well, that can have such severe impacts on your life throughout your life that it really does. I think it does require more depth than, oh, I've just got a skin condition sort of chat.
Yes. Yes. I mean, it's not just a rash. It's not, you're dealing with the complexity of a skin condition that flares up and at times is better under control, that can affect your other organs, can affect your joints. It affects the way you perceive yourself, the way you cope with situations, the situations you avoid. Not to mention that suddenly you become a patient with a chronic illness and you have to navigate that whole system of treatments and messy, unpleasant treatments and doctors and hospitals. So that it's multi-layered. So, you might see me and you might see psoriasis on my leg and think, oh, she's just got a skin condition. But what you won't know is all the other stuff that goes with it, the feelings of shame, the feelings of anxiety and depression, the feelings of out of control, of feeling hopeless, and so on and so on. So,
Mm.
we like to think of it as much more than a skin disease.
Mm. Should we just go back a bit? Because you started having the condition from a very early age.
Yeah, so I started having like a few patches that we didn't really know what they were. one on my scalp and one on my elbow. I fell. I was running in the playground with my friends, and I tripped and fell and cut my elbow, and it just didn't heal up, and it just didn't, and it sort of scab over, and it would peel off, and then it would scab over again. And we were so puzzled by this, what on earth was it? Now I know, it's what's called the Koebner phenomenon. So when you have psoriasis, if you cut yourself or damage your skin, that generally turns into a patch of psoriasis. But at the time, we didn't know what it was, and I think it just resolved. Eventually, it did go. We never thought about it. So that was in primary school. But then in my early teens, then when I was in secondary school, I had started to get a few patches, like on my eyelids, on my forehead, in my ears, and it very quickly was out of control. And by the time I saw a dermatologist in the hospital and got a diagnosis of psoriasis, it was extensive. My arms, my legs, back, tummy, scalp. And at that time, we had no clue what to do or how to treat it. So I wasn't moisturizing it properly. So it was splitting and sore and flaking, and I was so embarrassed because it looked so awful. People were commenting in class and making fun of me. So it was quite devastating. And it wasn't until I think I got prescribed creams and stuff, and nothing really worked. It was just getting worse and worse and worse. And then we took a family holiday to Benidorm, and it was in the school holidays in the summer, and it was lovely and sunny, and we had 2 weeks. And it was in the 80s, and nobody used sun cream in those days. So I was probably massively overexposed to the sun. But it went everywhere, everywhere. And it was like a miracle. So I came back home with clear skin and a tan. But it didn't take long for the patches to start coming back again. And that's really been the story of my life since.
And I think that's the devastating part of it, or the cruel part of it, that it does go. And
Yes.
then it starts coming back again. And you think,
Yes.
why? What have I done that's different?
Yes, you do. You question yourself all the time, and you worry. Even well, for me, I don't know if it's the same for everyone, but when it's clear, I'm scanning all the time. Is that a new patch? Is that a patch? Oh, is my wrist hurting? Is my thumb joint hurting? So you don't really enjoy the clear skin, because you're almost jumping ahead and predicting the future of it coming back again. Yeah. So, I mean, it's definitely impacted all my holidays from developing psoriasis, because I would know that the sun would clear me up, and I'd know I had 2 weeks and I'd need to get as much sun as I could. And then every morning looking at thinking, oh, it's cloudy. It used to rain wherever we went in the world. We used to think we should go to places with droughts because we always took the rain. And I would stress and think, I need the sunshine, because then at least I would have a month or so of clear skin before it started to come back again. Yeah.
I want to go back to the anxiety bit, because there was a part in that I want to ask you about in your book, which I thought was very interesting. But the first bit, the main thing, and I don't know if it is the main thing, but I think it's very important. And then it was one of the first major topics you spoke about, was the depression that comes with psoriasis.
Mm-hmm. So it's very common for people with psoriasis, and in fact any health condition, to feel low and depressed. I think there's a quite a complex relationship between psoriasis and depression. So they think maybe some of the mechanisms that cause psoriasis, like perhaps low vitamin D or some of the inflammatory processes, can also impact someone's mood. So there may be two things going on that may cause depression. But it's not hard to see why someone with a skin condition like psoriasis would become depressed, because you start to feel badly about yourself, you start to feel a bit hopeless, you start to avoid the things that make you feel happy. So you don't go out with your friends, you might miss a trip to the beach or swimming because you're too embarrassed. So you're not getting like the positive stimulation in your life. And a lot of people, there's certainly been times in my life when I've just wanted to isolate myself, and that doesn't help with mood either. And then what can happen is, as you become depressed, your thinking can become very negative, and then it doesn't take long for it to spiral downwards. You know, your thinking becomes negative, you feel more low, you do less of the things that bring you a sense of pleasure, and a sense of sort of achievement and mastery, and then you feel low, and so on and so on. You might start eating badly, sleeping badly, and it can quickly get out of control.
And it is a vicious circle. And you know what, I was thinking about how we would promote your coping with psoriasis. And as I said to you earlier before we started recording, we could in many ways be talking about any chronic health condition, because that's the whole thing about chronic health conditions. They all come with so many similar, I don't know if the word is traits, but symptoms.
Yeah, for sure. I think you're right. And I think so. So I'm a clinical psychologist and I specialize in working in health settings. So for the majority of my career, I've worked with people with physical health problems, kidney, heart disease, and I currently work with people with cystic fibrosis. And, you know, and I've seen across my career the same sort of pattern of, you know, the symptoms affecting people's mood, affecting what they do, what they don't do, which then affects their mood and affects the way they think, and so on, and being quite a difficult spiral to get out of. And I think, you know, very often it's not just the symptoms of the condition, but it's the fact that they present so many challenges, like they limit your opportunities in life. You have to do lots of treatments, you know, you have to deal with things that other people your age aren't having to deal with. And, you know, and that's why you become much more vulnerable to depression. You know, I think of it as a little bit like scaffolding, you know, like we all develop scaffolding around us that help support us in times of stress and difficult times. But I think when you've already got all these vulnerabilities and you're dealing with such a lot, perhaps your scaffolding isn't quite as secure. So so something might trigger a depression much more easily than it would, for example, had you not had the health condition or the skin condition or whatever. Does that make
Absolutely.
sense?
Yeah, no, totally. And sort of moving on from depression is the next thing, is the sort of anxiety and stress that you mentioned. And I think a lot of people who, and in your book you mention when your psoriasis is particularly bad, people say, oh, you must be having a very stressful period. And
Yes.
it's like, well, you know, I'm surprised that I think you say that there is no evidence that actually stress makes, it's like what it's the chicken and the egg situation almost, isn't it?
Well, there is evidence, but what it is retrospective. So what that means is people who are having a flare in their psoriasis symptoms, they ask them what they think caused it, and then they'll say stress. And then that's the evidence that stress causes psoriasis, rather than taking it. So I think there have been some small studies where they've taken a group of people and they've monitored their stress, you know, day by day, and monitored their psoriasis. And in those people, it's quite hard to show a link between the stress levels and the psoriasis. So it's not that there's no evidence for it, it's very, very complex. And interestingly, when you asked people, you know, pre-1980 what they think caused the flare-up, they were much less likely to say stress, whereas now everybody says stress. So I know some researchers seem to think that that's a popular theory now. So people kind of look for the stress and then think that's what it might be. For me personally, because I've always heard this, oh, you know, it looks really bad. You must be stressed. Are you stressed? And because I'm a psychologist, I've paid quite a lot of attention to my stress levels and my skin, and I have never noticed it in me. Obviously, when my skin's really bad, I feel very stressed. Of course I do. But there have been times in my life, you know, when I've done lots of stressful things and my skin has not been too bad. So I've never really noticed it. But I should also say that there is evidence that stress management techniques do help with psoriasis. So there was a study done, I think it was maybe about 10 or 15 years ago, and there were two groups of people having phototherapy for their psoriasis, where you go into the light cabinet. And half the group just had it as normal, just going into the light cabinet, and the other half had a mindfulness meditation to listen to while they were in the light cabinet, and you know, to manage their levels of stress. And those people who had the mindfulness, their skin cleared up faster. So, you know, there might be something in it. And certainly when you're stressed, your body responds with inflammation, and you release cortisol and adrenaline and all those things that will, that may make psoriasis worse. So who knows? It's very complex. But I think what I've found personally is that when people say to me, "Oh, you must be stressed," I found it quite frustrating, because I think, well, I wouldn't actually call myself someone who gets stressed I don't think of myself as someone who gets stressed very easily. And it's almost like it's a little bit of blame. If only you learn how to manage your stress, your psoriasis will be under control. And I think it's not that simple, is it? It's a normal human emotion. I need to get stressed from time to time in order to function in this world. But I mean, I do try and limit my stress. I think I put in the book, I don't watch jumpy movies, because I think, well, that might make my psoriasis
Yeah, that
worse.
made me laugh.
Yeah, but I don't. Yeah, and I have 3 children. They all know not to make me jump, because I get really cross. I say, you could make my psoriasis worse.
But the funny thing, well, I was going to say, the funny thing is that if you believe that it would, there's a good chance that it would do. Because I am a great believer. If you think you're going to get think something's going to be better, having a positive things make positive outcomes
Yeah,
far
I mean,
more often.
it does seem to be some evidence in that, that your mindset can influence outcomes. Certainly positivity, there's lots of evidence for the benefits of positivity. And I imagine if you are under stress and you feel stress impacts your skin, that probably will impact your skin. It's going to feel horrible, isn't it? You're going to maybe
Mm.
not take care of yourself like you should do. You're going to be, you're not going to put your creams on like you should do. You might eat the wrong kinds of food. You might have a few drinks or whatever, cigarettes. So it becomes a little self-fulfilling then, I suspect.
Yes, and that's what I kind of really noticed in your book, and I hadn't really thought about it, is that if you one negative thing can then impact and then lead on to far more negative things. And once again, we're back to that vicious circle type of thing.
Yeah,
One doesn't necessarily notice it as being a huge vicious circle, but it's just a small one that's rolling along in the background.
completely. Yeah, for sure. Yeah, yeah, definitely.
So no, that's really tricky. I was just having one of the one of the other main ones that I just think is just so sad and so difficult is the word shame.
Mm. I think that's a really big thing in
Mm.
psoriasis, and I think perhaps that was the last thing that I really came to understand about myself and my own reaction. Because growing up well, throughout my life, there have been times when I've had very little control over my skin. COVID, for example, I couldn't. I was working all hours in the NHS. I know we had beautiful weather, but I didn't go out in it because I was always at work. I couldn't access phototherapy, and my skin was terrible. It was absolutely terrible. Um, and how did I cope with it? Well, I hid it. So I think that if you ask my colleagues, how was Catherine's psoriasis during COVID, nobody would have had a clue what I looked like under my clothes. And I was absolutely covered in it. And I think what the shame has done to me over the years has made me an expert in hiding and avoidance. And so, although I would tell people I had psoriasis, I would never, and probably still not, show it. So I would wear clothes that hide it, try and cover it up with makeup. And I think that's it, and I think it relates strongly to the feelings of shame that I felt about it. So I could say the words, but I never, I knew that I had a lot of expertise that I could share with people about how to cope with psoriasis, but I never wanted to be the psoriasis psychologist. And I know that was because I felt so ashamed of it. And I think that's the one that I still struggle with and I still work on. And I think part of my therapy was writing this book and putting it out there and doing things like this podcast, because I'm not hiding from it. I may not have my skin on display, but I'm talking about those painful things. And that really dilutes the shame. It's incredible when you start to talk about it, it just dissipates. The shame starts to dissipate.
But that's quite often because we build things up, isn't it? to be monsters in our own head. And then
Yes,
actually when we get them out and examine them and put them into context, you suddenly think, well, hang on a moment, this is
yes,
ridiculous.
yes,
And I'm absolutely not saying that psoriasis is ridiculous. Having been, having been covered head to toe twice in my whole life, I know what it's like.
yes.
But as I said, I'm one of the lucky ones that it never stayed.
Yes. But I think if you go onto Instagram now or any social media, there are a lot of young people who have been very open and sharing photos of their psoriasis. And I think that's really brilliant for the shame, for the feelings of
Mm.
shame, because I look at them and I don't think there's anything they need to be ashamed about. I think they look like they've got psoriasis. It looks maybe sore, but it doesn't look disgusting, or they don't need to be ashamed. They look beautiful. They look amazing. So I think, the more we talk, the more we communicate, the more we reduce those feelings of shame. And I think what I'd done over the years was the secrecy and the silence and the not telling people and the hiding it, which then the shame really grows. It takes off in a really big way, because you're like, well, you go out and someone says you look really nice, and in your head you're like, well, that's because you don't know what I really look like. So you never take the compliments, you never.
Why do we always do this?
Yeah,
It's
we do, don't we?
I think everybody does, but it's just heightened when you have something that's not acceptable to the beauty that we supposedly all aspire to, or
Yes.
similar to that. And I mean, I do think it really helps if celebrities mention it. So we know that Kim Kardashian,
Yeah,
um,
definitely.
Cara Delevingne, and I was interested in your book that you quote Nabokov, for example, or John
Yes.
Updike. Um, and actually, I found that the extracts you put were actually quite depressing. They were like, oh my God, they were quite depressing from these people,
Yes.
but they nailed it in
Yes.
explaining how you can feel.
Yeah, no, I think you're right. I think the celebrities who talk about it are brilliant. Kim Kardashian, for example, and her mum apparently has
Oh,
psoriasis. Yeah, and I think it makes it a whole lot different for people like me then to be able to look at someone like Kim Kardashian. Of course, she's amazing, isn't she? She's beautiful. Um, Psoriasis or no psoriasis, and so that gives you a little bit of confidence, doesn't it, to think, well, maybe
anybody
maybe
can
that's
have
the
it.
same for me.
Yeah,
Yeah.
I think it's that anybody can have it. That's the whole thing.
Yeah.
But that sort of moves on to how do we react? And you've got a really good thing in your book of explaining how do we react to people's reaction,
Okay.
which I think that you got it from, or having worked with Changing Faces, who are an excellent organization who we've worked with before, and I was always very impressed with the way that how you tackle things head on, basically when somebody says, oh, what's that?
Yeah. So um gosh, how many years ago? 16 years ago or so, I worked in the cleft lip and palate service at Guy's Hospital. Um, so working with young people who often got lots of comments and questions and unwanted attention about the appearance of their face. So part of our job was to help support them to manage it, because we didn't want them to hide themselves away or not do things. And a little different to psoriasis, they couldn't hide it, it was on their face. So we would use this strategy, which, as you say, it comes from Changing Faces, where we would try and prepare the young person to deal with the situations. So if they went out and somebody said, oh, what's wrong with you? Or something nastier, they could just deal with it and they wouldn't have to think. They were rehearsed rather than deer in the headlights. Now I'm really panicking because everyone's looking at me and I don't know what to do. So it's really simple. And learning that and working with these children, I kind of took it on board to do for myself as well. I thought, I can do this, I can learn it. So it's three parts to it. The first part is you just give an explanation, and it can be short and sweet, like, oh, it's a skin disease, it's psoriasis, or it can be more complex, like it's an autoimmune mediated condition. It affects lots of, think, well, they bloody at us, so I'm going to tell them, sit down, you can have a lecture. So it can be up to you. Practice it, rehearse it, a short explanation. The next stage is a reassurance. So people seem to need just to like, oh, I'm being looked after by the doctor, or oh, it looks sore, but actually it doesn't hurt, or, I try not to let it bother me. So explanation, reassurance. And then the final part, which people think is going to be the hardest part, is distraction. So if you want to carry on talking about your psoriasis, go for it and talk about it. But if you've had enough and you don't want the attention on you, then you change the subject and you distract someone. And you might think that that's hard to do, but it's remarkably easy if you're prepared. So you just come in with like, did you watch the game last night? Did you manage to get tickets for Oasis? Are you going to the meeting later? And you change the subject. And people do not notice that you've done that.
But, and
So
I also,
go on.
sorry, I was just going to say, and I also think people think, gosh, they've been let off the hook in many ways because they've been made to not feel bad. Because when you do say something like that and you go, shouldn't have said, yourself sometimes you think, oh, I shouldn't
Yes.
have said that.
And it's not, of most times it's not intended to be
Yeah.
unkind or make you, what people don't realize is that lots of people ask you and you have had experiences of it being horrible, so you're primed and you don't want the attention. But actually by explaining, reassuring and distracting, you may be spreading awareness and educating someone, and that's not a bad thing. So you don't necessarily want to make the person feel bad if they didn't intend to upset you in any way, shape or form, which most people don't. I've had times in my life where people have been unkind to me, but the majority, it's like, oh, what is that? Just, oh, is something bitten you? Oh, have you burnt yourself? Oh, that looks sore. It's that kind of thing, but not intended in any way to make me feel bad or ashamed, even though generally that's what happens. But I think with the explain, reassure, distract, I'm much less likely to feel ashamed and embarrassed. I just deal with it and then I feel I'm in control. That's
I was
pretty
going to say,
good.
it's about being
Yeah.
in control. I actually also say to people, it's not infectious.
Yes, that's good. Yeah, yeah, yeah. Because
Although that sort of takes it down to the next level of being a bit medical, but sometimes you feel that you need to say that.
yes, especially if people don't know and they're looking at it and they're worrying. You just reassure them, don't you? It's not contagious.
Absolutely. Then the next thing that you went on to, and it's something that we don't talk about, I think it's something we completely shy away for so many times, is about relationships and intimacy. We just push that away, and you tackle it in your book, which I think is excellent.
So having a skin condition like psoriasis definitely affects your relationships because you feel badly about yourself. You can't believe anyone would find you attractive. You limit your opportunities and you're less likely to date, and that, well, personally for me, and that kind of thing. So on that kind of level, that intimate level, it makes things difficult. But I think it affects relationships generally because I think that those feelings of shame and that hiding mean that you don't often tell people how you're feeling or what's going on for you. We're very social as human beings. We need relationships in our life, and oftentimes we don't use them. We don't take the advantage of the relationships. We just don't tell people what's going on for us and how we're feeling. So yeah, it's not something that's talked about. It's not something that when you go to a dermatology appointment, you'll be asked about your dating or your relationships. But absolutely, psoriasis does affect your confidence and your self-esteem. Yeah.
We've done many surveys at Talk House, and I'm just always amazed at the detail that people are so kind to share with the problems they have about, dating and what they would wear. And it could be for any chronic condition, but it's something that they're embarrassed about or how it affects them on a daily basis, and it's just so important to be able to share. And that sort of moves me on to the sort of last thing that's in your book, and which you provide a lot of information about self-help, about how to view yourself with compassion and all the different ways that you can get help. So and if you'd like to just expand on that, I'm sure that people would love to hear that.
So there's lots of different theoretical approaches that I use in this book. So people may be familiar with things like CBT or cognitive behavior therapy, which is one of like a range of therapies. But which can be really helpful. But the way I like to think of it is a bit like a toolbox. So you can have lots of different approaches, different techniques, different strategies that might help you at one time, a different time or another. And I think what I try to do in the book is talk about the kinds of common psychological issues or struggles, and then the strategy or technique that might help you if that's the thing that you're struggling with. So for that day, you might want to take, like, thinking about CBT out of the toolbox. Um, so I know that people, so I'm trained in these therapies, and that's the kind of thing that I would deliver in my job, but not everybody can access a psychologist. So what I wanted to do was to put them in the book as sort of simple self-help strategies that you could use if you were feeling, for example, so if for example you're somebody who has a very critical internal voice, so that you speak harshly to yourself, oh, you look rubbish, oh, they just said that but they didn't mean it, because you're terrible, you'll never have a relationship, all those, that kind of critical monotone that just goes on and on and on in the background, and you're not even hardly aware of it, it just rambles on. What I really hope in this book is that people will think, crikey, I do that. I never thought about it before. I do that. When things go wrong, I'm not a friend to myself. I give myself a really hard time and make everything 100 times worse. So if you've identified that that's something that you do, these are the things that you can do to start to develop compassion. Just simple things like speaking to yourself like you would someone you love, like your best friend, like a child. You wouldn't say to them, oh, you really messed that up, it's going to be dreadful now. Your life's over, give up. You might say that to yourself, but you wouldn't say it to a friend. It wouldn't help them. It would make them feel dreadful. It's not going to help them succeed. So, to spot when you're using a self-critical voice and talk to yourself in a way that you would to someone you love. So that's just an example of one. And I go through CBT. So if your thinking is so if you are, say, walking down the street and you're thinking, everybody's staring at me, everyone thinks I look disgusting, to notice that is actually a thought, it's not the truth, but it's making you feel dreadful. And are there other ways of thinking about the situation? So it's,
sorry, carry on.
I would say it's not one simple thing, do this and you'll feel all right. It's lots of different ideas and strategies, and you may use a lot of them or one of them or different ones at different times.
I think, yes, exactly, isn't it? It depends how you feel at the time and what you remember you're meant to be doing, and I suppose it's practicing them as well.
Yes, yeah. It's all the time, isn't it? It's a process, isn't it? And I think a lot of it is about awareness. It's just noticing the little traps that we fall into in the way that we behave, the way we talk to ourselves, the way we think. Just a self-awareness, knowing the impact of that, and then having some idea of how to manage that.
And I think we could all learn from that. We don't need to have psoriasis to do those things. And what I liked about in your book is at the back, there's pages of various places, because what works for one person doesn't necessarily work for another, and whether it's a charity or an organization or whatever. But I think the real thing that came out was actually the usual thing, but it's so true, you're not alone. But do go and seek other people who have it as well, to hear what they say. And that could be on a forum. So you could be completely, nobody knows you're there, but you could just be reading what the forum says to get a feel that, and I know that at the moment we're running on Talk Health, one of our online clinics. And I know we don't have lots and lots of posts, because I know most of the time people are just waiting for that one post that comes up, and they always say, gosh, that's what I would have asked.
Yes, yeah.
The same questions.
Yeah, I think you're right about forums. I think connect with other people with psoriasis is really, really important. And I think, now we can connect with people across the world, can't we? It's amazing. We can go onto forums. Like you say, you can be anonymous, can't you? But, people share photos and support one another. And that's really, really helpful.
Absolutely. Catherine, thank you so much for your time. It was a great read, and obviously because it was personally of interest to me, but anyone that has psoriasis will completely understand and identify, and hearing about your own story, which I thought was it is brave to share your own vulnerabilities as well, and I hope your mother enjoys reading it as well.
Thank you. Thank you very much. I've really enjoyed it. It's really nice to talk about these things. Yeah, and it, this is part of my development as well, is just trying to be more open, and it absolutely does help me feel better about myself. So thank you.
Thank you, everybody.